This morning, we're focusing on a health issue that impacts millions of men and their families every year, prostate cancer. We'll speak with doctors and a patient about the symptoms, the treatment options, and the importance of early detection. Let's go on the record.
WPBF 25. This is On the Record with Todd McDermott.
September is Prostate Cancer Awareness Month. It's one of the most common cancers diagnosed in men. According to the American Cancer Society, about 314,000 new cases have been reported in the U.S. so far this year. Good news is early detection of prostate cancer saves lives. Joining this morning to talk more about prostate cancer prevention, the symptoms, and treatment options is Dr. Patrick Tenbrink from Jupiter Medical Center. Doctor, thanks for being here this morning.
Sure.
Let's jump right into it and first talk about, do we know more about why prostate cancer is so common?
Yeah, I mean, the prostate, every man has it. And as we get older, that prostate just continues to grow and progress. That prostate activity is the big thing that we see, meaning that the prostate gland is something that never stops slowing down in its growth. And so thus these cells just have this increasing turnover, this just rate of proliferation or growth. And so sometimes with this and this rate of growth, we see these cells just changing. And that's why, again, as that age demographic gets older, those rates and the concerns for how often we see cancer starts to rise up.
All right, you're going right into my next question. That is there a segment of the male population most at risk for this?
Sure, and that's where a lot of this is starting that screening process. And again, prostate cancer is one of those, the screening process. When do we start? Often at the ages of 50 to 60, and sometimes as we get into the older ages of 70, we continue those screening processes, especially family histories. So it's a big thing we're starting to understand, the genomics of this, the gene relations between our sons or fathers, that we can see some of that. So sometimes we do start earlier, before we reach the age of 50, if we do have a family history with that.
So that's it. Let's get into that a little bit, because obviously if you have a family history, you won't wait till 50
Sure.
to be screened. But what are the parameters? Because there's a certain point where men won't be screened for prostate cancer anymore, correct?
Correct. So we kind of get to this discussion. Maybe not won't be screened, but it's a bigger, deeper conversation with the patients. Meaning, often as we get older, again, the probabilities of prostate cancer start to rise. I think statistically, it's about 50% of men over the age of 80 have prostate cancer. But will it ever affect their life expectancy? No.
I want to stop you there. You said
Sure.
50%.
40 to 50% of what we're seeing, correct.
That's something I think would surprise a lot of people.
Correct. And so it's something that it's hard to have sometimes this conversation with older patients that really say, can we continue? And that's why I was saying, as we get older, there is some recommended statements of after the age of 70, we start to maybe stop screening or monitor, depending upon symptoms or other signs or cautions.
All right, let's talk what the screening involves. We know about the PSA test. Explain that, and obviously that is just the beginning of screening, correct?
Correct. So that PSA test is kind of the brink and opening the door to most often meet me or kind of that conversation with the primary doctor. So PSA, what that means is it's a prostate marker. It's a prostate-specific antigen. Think about it, just the activity of the prostate, meaning that PSA really just gives us an insight to how active your prostate is. As that PSA rises, that just shows more activity. The concerns is cancer are more active than normal cells. So that rise in activity kind of starts that process to say, hey, something's going on, we need to dive a bit deeper. With the progression of technology and the advent of new kind of test and screening tools, in the past we had to just jump to a biopsy, which are great but hold risks. So now we have some tools like a 3T MRI. What it does is kind of looks at the prostate from an anatomical standpoint and says, hey, within there, are there any areas of concern? Not a cancer, not a statement of this, but hey, this gives some concern and we should keep on looking.
And does this come after you get a PSA test and it's at the number? I know it's a number scale.
Correct.
Is it a certain number, you go on to the next screening?
There's always the parameters on the cutoffs. Sometimes for age, the 4 is the higher concern or questions, but more often it's also the progression in numbers, meaning that if you have a low number, but we recheck it, we screen and we continue to watch, sometimes those numbers progress in its velocity, meaning 1 is great, but it jumps to 2 and then 2.5, meaning that change is a bigger concern than the total number. And that's why the consistency of that, the rechecking of the PSA is really the big important part.
All right, what about, are there updated guidelines for men when it comes to risk factors?
Sure, and that's where kind of some of this comes into the genetics, the family history, and sometimes we're understanding the BRCA gene, the breast cancer gene concern. We're really finding that there are these newer associations and concerns with that associated with prostate cancer. So sometimes we ask patients, any family history of prostate cancer? They might say no, but if you look a little bit farther and converse and say, yeah, but my mother had breast cancer, she's BRCA positive, that again puts a little bit of a, hey, let's look a little farther.
Can I jump to treatment options for you? There are several here which maybe terms people don't know. There's the nano knife, which I looked up is not exactly a knife at all. What should we know about that?
Sure. So in prostate cancer, the general big two broad topics are radiation therapy or surgery from a treatment standpoint. There's also something called active surveillance, which is a great topic to talk about, but a little bit outside of true treatment. That nano knife is a little bit of a subcategory, meaning that as we start to get better and better at finding early prostate cancer, sometimes we have the ability to really fine tune, hey, we have prostate cancer on only one spot of that prostate because we found it so early. Why treat the whole prostate? Why take the risk of the possible complications that can come from treatment and focus on just those small points of cancer? And that's where nano knife or these focal ablations really come into this new iteration of what we can offer men. Meaning before, yes, like you said, 300,000 and above men are being diagnosed just this year. Now we can have the ability to help those men that have those treatments while reducing those side effects.
And I also want to get in very quickly, I've got about 30 seconds left. I know you have a new urology center.
Correct.
At Jupiter Medical Center. Can you tell us a little bit about what makes it unique?
Sure. So the Barb and Joe Charles Center for Urology is this great kind of growth me and actually patients of mine really put together to say, hey, let's build our ability to bring some of the best and finest techniques, physicians, and care at Jupiter Medical Center in the urology field. We actually excitingly just hired a new robotic oncologist, started yesterday at the department, and we're really pushing the bounds of what we can offer, exactly like this nano knife, somewhat in that sense to improve the outcomes while reducing those risk and complication rates.
So much more to talk about. Dr. Patrick Tenbrink, thanks for joining us
Absolutely.
today. Again, we are not done here yet. Up next, a prostate cancer survivor shares how early detection changed his life. We'll talk about his diagnosis, treatment, and why screening is so important. That's when On the Record returns.
You're watching On the Record on WPBF 25.
Welcome back. Joining me now is Robert Kesselman from Port St. Lucie. You were recently diagnosed with prostate cancer, and I know you're recovering from treatment.
Yes.
So first question just has to be, how you feeling?
I feel almost back to normal. I feel great.
That's fantastic. And I happen to know you didn't have your treatment, and we'll talk about that in a moment, very long ago.
No, it's the beginning of August.
It's amazing. It was the first week of August.
Yeah.
Now how much time has passed? What procedure did you have?
I had the nano knife procedure.
And I know that Dr. Tenbrink was your doctor.
Yes.
Tell us about the discussion you had about treatment when you found out that you'd been diagnosed.
Well, when I found out, I've been an advocate in keeping an eye on it because I had family history. And when I was diagnosed back in March, the urologist I'd been with for many years had basically said, we're going to keep an eye on it. You know, we'll do PSAs every 3 months, do yearly biopsies, MRIs, and we'll just watch it. And that was his answer. And talking with my wife and associates I work with, you know, we kept feeling like maybe there's more we can do. And so we started researching on it. And we love, you know, Jupiter Medical Center had a great reputation. My wife actually found Dr. Tenbrink in there and saw everything that he was capable of doing. And we set up a meeting for him right after I saw my other urologist, and I brought him all the results of everything, and he mentioned the nano knife, and he says, you know, he says, your other urologist was fine. You can just keep an eye on it and keep watching it. He says, but you have to mentally live with that, knowing that you have cancer in your body.
And that is a statement here that really is important to some men. I have a very close friend of mine who, when he was diagnosed with what they termed a tiny cancer, his prostate, he said, take it out. Like, just no waiting, no monitoring, it's gotta go. And that could have been a mental strain on you. What were those months like, well, from when you got diagnosed to when you actually had the nano knife procedure?
Well, you know, when I first found out, I wasn't sure what way we're gonna go, and I started researching, and I heard different things about taking the prostate out and not waiting and keeping an eye, but I looked at all the months of recuperation and possible side effects that could last forever, and being taking medicines for the rest of my life. And I just said, it's an option, but there's got to be other options. And when I saw Dr. Tenbrink, and he just, you know, said it's, you know, it's isolated, it's a nodule in the left quadrant, and we can take it out. And he explained the whole nano knife procedure, which was really interesting. And he says we could take it out and it'd be gone and you don't have to deal with it anymore. And the good thing about it is if later on, you know, it does come back, it could be treated again.
And the same way, yeah.
The same way.
Now, you mentioned family history. It was your dad, correct?
My father was diagnosed with prostate cancer right around the same time as me at age 65. He later had bone cancer and passed away at 78. I was diagnosed at 65. I just turned 66 a month later. And I have other genetic stuff from my dad. I mean, hiatal hernia, of course, the male pattern baldness.
You had to blame Dad for that, didn't you?
Oh, yeah.
How did your dad's cancer impact you when you were diagnosed? Obviously, it had been on your mind, I'm sure.
Well, it had been on my mind even before I was diagnosed because my father's history. And yeah, I started keeping at an early age, starting having my prostate checked at age 40. I did develop enlarged prostate, and so I had symptoms. So I was always keeping an eye on it, but then for several years, I discussed it with the physicians I was working with, and like, I want to do PSAs every year. And it was my pushing. I said, I want to do it every year, and every year I did it. And every year it came back within normal limits until this past March.
That really speaks to advocating for your own health, because even if there are certain guidelines, you are really in charge of your health.
Well, yes. I mean, I listen and I listen, but you have to sometimes just explore more and see if there's other things to do.
To men out there who are listening to your story, describe the physical and emotional journey for you from the time you were diagnosed to where you sit today.
Well, the physical part of it was basically hadn't changed all that much because of my symptoms over the years. So having the cancer, I didn't have any other symptoms that were new. It was strictly finding out. The mental part of it was anguish. I mean, it was horrible when first diagnosed. My wife and I married 45 years, beautiful kids, grandkids. We, all of a sudden everything started coming across my mind, how severe it is. You get a biopsy done, you get an MRI, it takes weeks to even find those results. And that week was like, I didn't sleep for a week, and then once we found that out, and then when I got, the preliminary say, well, let's just keep an eye on it, that didn't sit well either, just mentally to say, I don't want to be walking around with cancer in my body.
So you've got this dark cloud hanging over you, and now you're discussing options with your doctor.
Right.
At what point did the clouds start to lift as you approach treatment?
Honestly, as soon as I met Dr. Tenbrink and I told him how I felt and my family history and whatever, and he said, I think this is a perfect option for you. He described it to me. He explained the whole procedure. I was like, oh my God, right at that point, before even doing the procedure, I felt like a big weight was taken off my shoulders.
All right, so I've got to finish with somebody out there who's hesitant about getting screened or isn't particularly proactive about their health. You can talk to them right now. Tell them what you think.
Don't wait. Don't wait, because if you wait and it's too late, if it spreads, it goes somewhere else, it's too late. This is an early detection. I took care of it. I was proactive about it, and I am not sorry, and I recommend it. I have my children doing it. I have older sons. They've already had prostate exams. They're getting PSA. And I have them on it.
Well, I would testify sitting here with you. You look healthy, you sound healthy, and we thank you, Robert Kesselman, for sharing your story today.
Thank you so much.
Thank you again. Well, coming up, the future of radiation oncology. Leading doctor joins us to talk about how the CyberKnife and other cutting-edge advances are transforming cancer care and treatment. Welcome back. Here with me now is Dr. Nathan Tennyson, who's the Medical Director of Radiation Oncology at Jupiter Medical Center. Doctor, let's start with the latest advances in radiation oncology and this CyberKnife, which I understand is not a knife, but this is kind of the cutting edge of the treatment.
Yeah, I've been at Jupiter Medical Center almost 10 years now, and even since I've been there, I've seen the evolution of radiation for prostate cancer. It used to take 9 weeks. Everybody who came in for radiation for prostate cancer, 9 weeks of radiation, 44 treatment sessions. It's a long time. And now we know, based on clinical trials, that for many patients with prostate cancer, we can do that treatment in 5 treatment sessions. And so the CyberKnife is a type of radiation machine that can very precisely deliver that radiation. It can follow the prostate if it moves during treatment, automatically adjusting for that. So it's a great way for men with earlier to intermediate stages of prostate cancer can really shorten their radiation course to just 5 treatments.
That is really amazing considering you said 44 treatments. When did this come online and how many men are using it who you deal with?
That's a great question. Over years it's taken for, the clinical data to really mature for us to know that it's safe for some men to get CyberKnife, or we call it stereotactic body radiation therapy, for their prostate cancer. I see a lot of men who are eligible for that type of treatment. It's mostly, men with what we call intermediate risk prostate cancer, sort of middle of the road prostate cancer. They need some treatment, but it's not so advanced that they need sort of more aggressive treatment. And so for those men, it's great. You continue your normal daily life. A lot of these guys are playing golf. You come in for 30 minutes, 5 times. There are, of course, some side effects associated with it, but they're typically pretty limited.
What are the side effects?
Great question. So mostly urinary. So, you're peeing more often, getting up more at night. It's more urgent. Those things go on for about the 2.5 weeks of therapy, and they last for weeks afterwards and then slowly go away. And most men get about back to their baseline urinary pattern after the radiation's done.
Now, you say these are for intermediate prostate cancers. More advanced radiation, we still go back to those weeks and weeks of treatments, and that could be overwhelming for a patient, I'm sure. How do you approach that?
That's a great question. Anybody who comes to see me, unfortunately, has cancer, and the majority of my practice is prostate cancer. And the first thing we do is we make sure we're giving them the right treatment. So there's genomic testing we can do on the prostate cancer. There's scans, PET scans, it's called a PSMA PET from head to toe, to look at their entire body to make sure we know exactly what we're dealing with. And if we do all that and find they have a bit more advanced prostate cancer, sometimes lymph nodes can be involved, then it is about 5.5 weeks of treatment, usually combined with some sort of testosterone suppressing drugs, sometimes given by a medical oncologist. So while those treatments are more intense, patients typically actually do quite well with that. Side effects, instead of just being over 2.5 weeks, of course, when you're giving 5.5 weeks of treatment, can be a little bit longer, but men typically do well.
We've talked so much in this program about the various treatments, and some of them are relatively new, and they're available at Jupiter Medical Center. How's it changed the journey for prostate cancer patients to have these options as compared to the past?
So really, in radiation oncology, our focus is shortening treatment times, reducing side effects, and we've done that in a couple of ways. There are these what's called hydrogels that we place between the prostate and the rectum. Small procedure, we put a little needle between the prostate and the rectum and inject a substance that moves the prostate away from the rectum. And so when we deliver radiation, the amount of, we call it rectal toxicity or bowel toxicity, is less. And that's been in the last 5-6 years that we've really started to do that. With these advanced radiation techniques, we can really hone in on the prostate. Sort of the extraneous radiation dose is very limited. And so doses to the bladder, the rectum, all these organs around the prostate, we've really been able to control, with the advancing technology, like I said, even since I've been practicing. So that's really the goal. We want to deliver safe, effective radiation doses in the shortest amount of time, get people back to their normal life, and sort of put it in the rearview mirror.
Anderson Family Cancer Institute Center's been growing, evolving. Obviously, we've talked about these various treatments. Do you as a doctor reflect on the change, the tools you have, and how good it is to be able to offer these options to your patients?
Yeah, it's been great. Actually, the building was built around me, so that was an interesting time. It was sort of going up while we were treating
could give you
patients.
credit for it if you want.
No, but it's an exciting time to be practicing medicine at Jupiter Medical Center. It's really amazing. It's a beautiful building. But the doctors, the nurses, everybody there is dedicated, with a common purpose to take care of our cancer patients.
I've got 30 seconds. Can you give me one success story that impacts you, that sticks with you, that you'd like to tell?
Sure. Like Dr. Tenbrick was saying, every patient that comes in, we want to make sure that we address their concerns and we take that weight off their shoulders. And so, even today I saw a patient, they're scared, they're worried, they don't know what to expect. And so to reassure them, hey, it's going to be okay. Most patients with prostate cancer that undergo treatment do just fine. Side effects are pretty limited, and they go back to normal life. I get to do that every single day to patients, and so it's really a blessing to be able to do that.
That's a good way to end this. Dr. Nathan Tennyson, thank you so much.
It's been a pleasure.
Thank you very much. On the Record, we'll be right back. Thank you for making this part of your morning today. As always, we encourage you to be part of our discussion each and every Sunday right here at 10 a.m. Until the next time, you can watch This Morning's On the Record and every episode we've done on our website, WPPF.com, and on our free WPPF 25 News app. Have a wonderful Sunday. We'll see you again next week.